Yes, we are going live right now.
Excellent.
Okay. Hello, Dr. TJ. How are you?
Hi,
Good
Doctor. And
morning to you. Good evening to us.
yes,
I
yes.
thank you so much for your time.
In the U.S., we call you Professor, Professor Adel.
I am still an assistant lecturer. Didn't do my PhD yet, but hopefully I'm going to do it. Thank you so
Not
much, Dr. TJ,
necessary.
for
You're smart enough already. It's okay.
my voice is a little bit far, or you can hear me well.
I can hear you perfectly.
Okay, this is great. First of all, let me thank you so much for giving us some of your precious time to indulge us with your immense knowledge and your great experience in the facial aesthetic specialty. I'm very thankful for this opportunity and thank you for your time. So today we are going to talk about the liquid nose job or non-surgical rhinoplasty. And you know well that the nose is one of the most trickiest area to treat in the face. And it also, since it's the center of the face, it have a large impact on facial beauty. Could you tell us more about the anatomy of this area as long as with the normal ratio and proportions of the nose?
Sure. Just briefly talking, and I'm going to use myself as an example and just kind of point to the various parts of the nose. Before I start, I want to excuse my look. I just it was great timing because I just had the PDO threads done on my nose 3 days ago.
Okay.
My nurse practitioner put the threads here, so I'm a little swollen, and
yeah, I noticed. Yeah.
The swelling did cause swelling on the bridge here, which happened to compress on the lymphatic drainage, and therefore it caused some swelling on the under eye. So that's something that you want to make sure that you inform your patients. I've never had this with the fillers, but with the PDO threads, because there can be so much swelling involved, this can happen. And patients may be confused because they said, well, you did my nose, why is my eye swollen? So that is why. The lymphatics and some of the venous drainage has been compromised, so there's some edema. And it is 11 a.m. my time. I just woke up 2 hours ago, so I was sleeping, and also laying gravity causes the swelling as well. So hopefully by the end of the day, some of this will be subsided. Anyways, talking about the nose, well, globally, we divide the face into thirds. So we have like 1/3 here, the second third from here to here, and then the lower third here. So we look at overall ratios. When I look at a patient, I don't sit there and count thirds, or I don't pull a ruler, but I use my eye to just globally look at them and to look at the ratios. And a lot of the times the patients see the deficiencies, they see something that's not right, and they're asking for your professional opinion. You know that it's 1/3, 1/3, 1/3, but to them, when they look in the mirror, they're seeing something missing. There's something missing here. Either they have a short forehead or they have a short chin, and it's for your job to interpret what they're seeing that's missing and give them advice. So back to that 1/3, 1/3, 1/3. And then regarding the nose, just to kind of give some terminology for us medical professionals, because since we're talking amongst medical professionals, you've got the part of the frontal bone here, and at the apex of here, you have what's called the nasion. The nasion is part of the frontal bone. And as you go just a little bit lower, you've gone down into the nasal bones, okay? So the nasal bone, the lowest point here on the nasal bone, it's called the radix, R-A-D-I-X, radix. And below the radix, you have the rhinion. And then below the rhinion, you have the supratip. And then you have the tip, okay? And after the tip, you go lower, and there's the infratip lobule, okay, just below the tip. And you can see I do have an entry point where they put the PDO threads right there in the infratip lobule. And then below that, you have the columella, okay? So that's kind of the general features externally of the nose. And then we can talk about the, some of the internal structures later, but you also have, the alar right here and the supraalar crease. Blood supply, you've got the angular artery coming up here, and you also have the infraorbal artery and the dorsal nasal artery coming through the top of the nose here. So those three arteries, and the reason that's important is because when we're injecting the nose, that we have to be careful, especially with fillers. We have to be careful about vascular occlusion, of course, and there's certain areas that we are safer to inject, such as the midline, but it's not 100% safe. And so, what's your next?
Concerning the normal ratio and proportions, we have the nasolabial angle and the nasofrontal angle.
Sure.
What are the sex ratios between males and females concerning this angle, and how can you alter this angle with your approach regarding using filler or threads?
Yeah, the nasofrontal angle, it's the nasal dorsum and then the frontal bone here. Generally, it's about 115 to 130 degrees. So if you imagine that's a little bit obtuse, it's kind of an obtuse angle. If you have too obtuse of an angle, that doesn't look good either. And if you have too acute of an angle, it doesn't look good either. And I think for generally men have a more acute angle and women have a little bit more obtuse angle. So you can use the filler to basically alter that angle, and you're placing it in the point of the radix, by the way. Traditionally we have people that complain of a quote unquote hump, or they have a hump on their nose. In many cases, that's called a pseudo hump because they really don't have a hump. What they have is an underdeveloped radix. So it just requires some volumization in the radix to lift that area up. The other angle that is important to look at is called the nasolabial angle right here. This angle right here. This angle is very important. In men, generally, the average is about 97 degrees. So it's a little bit more than a 90-degree angle. For women, it's about 107 degrees. So it's a little bit more lifted than males. So for a male, if you want to keep a masculine look, you don't want to have the nose lifted too high, and then their angle is going to be a little bit too great, and it's going to look feminized. Unless the male wants to look feminized, that's okay. But generally, if you want to keep them masculinized, you don't want to lift that tip up too much.
Mm-hmm. Exactly. So speaking about the anatomy, the nose have 5 layers: the skin, subcutaneous muscle, fibrovascular layer, and fibrosteum. At which layer should you be targeting it and placing your filler product to ensure that you are going safely and smoothly?
So yeah, I do set regarding fillers specifically. I do multiple, I do multiple layers. Generally, for non-surgical nose job or liquid nose job, you want to go deep, right down to the bone and this area where there is nasal bone. When you're down lower part, there's no bone anymore. So generally, I'm going to be in the subcutaneous layer. Down here, you don't have bone, but you have the cartilage or the perichondrium. So generally, when I'm trying to give projection, I'm going a little bit deeper down to the subcutaneous. But every now and then, for example, if someone has a little shadow deficit, or maybe a chickenpox scar or an acne scar, or I'm trying to soften the alar crease a little bit, I can go a little bit more superficial. So I'm going more subdermal there in those layers.
Mm-hmm. I see. So it's acceptable to be injecting your filler in a superficial pattern. It's not always like you should place it deep. It depends on what you are trying to achieve with your filler.
Absolutely, absolutely. And I do it in such small aliquots that I generally, for the most part, nothing is 100% safe in the nose. As you know, I've seen so many cadaver labs where we dissected the nose. I'm sure you've seen this, and there's arterial blood supply that's crossing the
There's
midline.
always a variation despite what is your, you know that is normal. Yeah.
That is very normal. exactly.
Mm.
So nothing is safe. You just have to be on the lookout and to have a high level threshold to react if you see any blanching or any changes in the skin.
I see. Dr. TJ, tell me, well, the concept of a dual plane technique, we can apply it in the cheek area, we can apply the sandwich technique in the tear trough area. Do you think it's applicable to be done in the nose?
I don't think it's necessary unless you're trying to address some other issues, because generally, you can get that lift as long as you use a good high G prime filler. You can get that lift. Especially, there's no reason to do that, especially if you're doing it in the radix area, or the divot that people are often correcting on the top of their nose bridge. So it's not necessary, but the only concern about placing it not deep here is that if you place it superficially with the fillers, is over time I've seen that, and also in the tip as well, over time that the filler, if it's not cohesive enough, it can either migrate or kind of soften and flatten, and giving their tip a more bulbous, rounder appearance over time. I've seen this happen, and it's not desirable at all.
Mm-hmm. Speaking about the bolus, you're like, if you were going to talk about your own delivery technique, you would prefer to use a serial punctures along the nose?
Yes, so
in a micro aliquot pattern.
Micro aliquot, exactly. I take the filler and I transfer it to a BD syringe. That's what I do, and I just put
I saw amazing videos of yours where you're doing it with the PD microfine ultras in the syringe. Yeah.
Right. I think that keeps it a little bit safer when you're putting micro aliquots, so you don't have a big bolus in one area.
Mm-hmm. Speaking about the filler product, of course, it's we are going to think about it. It's more safe to use hyaluronic acid-based product, but I've seen a lot of people who are using the calcium hydroxide radius, injecting it along the nose. Do you think this is wise, or this may work fine if you're a skilled practitioner, or you should stick with using hyaluronic acid-based product?
You know what? I don't think I'm not afraid of anything. Really. I'm an emergency room doctor. I'm taking care of multiple catastrophic emergencies. Nothing really scares me, but I know a lot of people do use the calcium hydroxyapatite. I think, and I've seen some people even use both in the same patient. And they use HA here, and they use calcium hydroxyapatite in the tip. As long as whoever the provider or the medical person is equipped in dealing with any problems that happen, as long as you're comfortable dealing with dissolving the calcium hydroxyapatite, which you can, it's not an issue. It shouldn't be an issue.
Mm-hmm. So it depends on the clinician who's working. If he's skilled enough, he can go with. But as a beginners or someone who's first starting with doing liquid nose job, it's not good to go on with calcium hydroxide. Is it safe to use polymers?
As long as you, if you're able to dissolve polymers, which one are you speaking to?
Mm-hmm. Okay. So I'm sorry, there was a technical change. I couldn't hear your voice right now. Okay. So do you think it can be used as a sculpture or any filler based from polymers? Is it safe to be used in the nose, or this is no, don't do this?
Polymer like Sculptra?
Yeah, can we inject it? Can we use it for doing a liquid nose job, or this was it's not gonna be safe?
I don't. It's actually Sculptra is very safe, but the reason that you're doing it is to there's no lifting, so the Sculptra is not really ideal for adding it in the nose.
Okay. Dr. TJ, so when we were talking about the filler injection, you said to stick with the midline, but sometimes you have those patients who have the side of the nose, there's a problem.
Yes.
I know it's risky, you cannot place filler here, but there's your own special technique where you can give it a more straight look, or you may go on combining filler and threads. May you place filler in the midline, and I don't know if you can place threads along the side of the nose.
You can. Mm-hmm. So, but regarding the filler placement on the side of the nose, yeah, I do that in the more subcutaneous plane or the subdermal subcutaneous plane. If I'm doing it on the sides of the nose, I will not go deep. I would go more in the subcutaneous plane. Regarding if their nose has a deviation, if there's a curvature on the nose, you can use PDO threads, and you can put it, to the side. So in my case, I have the entry point right in the middle. If sometimes you need to bend or flex the nose one direction or the other, you can place the entry point a little to the side. You can enter the side and go up. So basically, you can go on the side of the nose to use the thread to pull the nose to the side.
Yeah, exactly. It's like you are building this area, and at the same time you are like moving it toward the non-affected side. Okay, I see.
The only exception is that sometimes the patients may have a very straight nose, but the nose is straight, but it's straight deviated. So straight, but it's straight at a different angle. So you're not going to really change that unless you do that surgically. So that in that instance, I'm not able to change the direction of the straight nose, where it points to. I can't change that direction.
So it's like there is always a limitation for the use of fillers and threads in the nose. Sometimes, some cases, they have to go on to surgery. There is no other solution for them. When will you decide to place filler in an area and a thread in another area, except for the situation that we talked about right now?
Sure.
What other cases? Yeah.
So I'm going to talk a little bit about, I made some notes about what I'm going to talk. These are the main reasons why people are looking for cosmetic nose treatments that are non-surgical. Sometimes they just want to try a non-surgical to see if they would like it, and then later decide they want to do surgery, which is fine. That's perfectly acceptable. Sometimes, like I said, we discussed the patients have an underdeveloped radix and they want to even their nose bridge. In Asian countries, where I'm from, in Taiwan and China and Korea, Asians typically have a very flat bridge. And they want to raise the height of the bridge. So that's a very, very common request that I get, being that I'm Asian and being that half of my clients are Asian in the United States. Another request that I get is someone wants to elevate their tip. So their tip has ptosis, or they have a ptotic tip. They want to elevate the tip. And sometimes people want to have a more defined tip. Okay, so those are pretty much like the 4 or 5 main reasons why patients are coming to me for a non-surgical nose job. And before I use the PDO threads in the nose, I could pretty much take care of all those issues with the liquid, with fillers. I can put fillers in the radix to elevate the divot. I can put the fillers all along the bridge to elevate the bridge. I can put fillers in the tip to give it a more defined tip. I can also put the filler down the columella to give a lifting effect for the tip. And I'll explain how I do that. So the same puncture where I have here, where I had the PDO threads, I would make a puncture here, and I would use a 22 gauge cannula. And I would put the cannula down the columella and then retrograde inject, put it down again, retrograde inject, and I would do about 3 or 4 times. And that would give a really nice lift and definition to the tip and raise the tip by injecting down the columella. Now,
Dr. TJ, sorry to interrupt you, but do you touch the anterior nasal spine?
I don't touch, I kiss it. It's just a very close, but you're not jamming it all the way down there. You go down, but I don't go all the way down to the spine, but very, very, very close. And then I inject retrograde. The reason that I use a 22 gauge cannula is the diameter of the inside of the cannula is 0.6 millimeters. The diameter of the columellar artery is 0.3. So you've got a cannula that will never cannulate that columellar artery. So it's very, very, very safe. Now that we have PDO threads, I also use the liquid to fill the radix, but beyond that, I can now elevate the bridge with PDO threads. I can lift the tip, I believe, more effectively with threads, barbed threads, especially when the threads have barbs, because the barbs actually do the lifting. So you can lift a lot higher with the PDO threads for the nose, more than using the fillers.
I can see. Dr. TJ, you are like an amazing mint PDO thread speaker, and I have attended your webinar with aesthetic immersion about the cat eye. How can or what make mint PDO threads that much special, and we can use it as the same in the nose?
What I like about the mint PDO threads is that their barbs are not cut. So if you take the threads, and typically they will cut the barbs into the threads, those cut barbs are actually very weak. They're not very strong. So the lifting effect of those cut barbs, which is majority of thread companies out there use cut barbs, are weak. So the mint threads, they actually have the barbs that are molded, and the thread is still there, but they take an extra piece of barb and they mold it onto the thread. They press it, and then now that the thread is an extra, the barb is an extra attachment to the thread. And the thread is not, the barbs are not just molded, they're molded and they're 360 degrees around the thread. So you've got barbs like in a circumferential pattern all around the thread. Another reason that so that's the main reason why I like the mint PDO threads for in general, for the lifting effect.
It's like it's 3D designed to be adapted to be used in a lot of areas to give a better lifting than other type of threads.
Correct.
Okay, how can you narrow the interalar distance of the nose with the filler? I know a lot of people do place it at the pterygoid fossa here, but does it actually work?
Using fillers, it's a very mild or subtle effect. You can also place the fillers right below the columella, right below the nasal spine. If you inject right in here, deep to the bone, it will lift up the tip. And when you lift up the tip, the nostril automatically will tuck in just
narrow.
Very mild, but it's noticeable. But with the threads, if you see my videos recently, I have been able to achieve a more dramatic nostril narrowing by putting the thread through here. These are the entry and exit points for the thread. Enter, exit. And the threads come out. They are bidirectional barbs. So the barbs are facing one way here and the other way here. So when I take the thread and I pull it and then I squeeze the nostril, the barbs grab and it keeps the nostril stuck like that. I mean, it stays just like that. And then
sorry, forgive me. Hold on for a second, because this is amazing and new. It's my first time to hear this technique. If you could explain it more, from where did you enter and where did you exit?
Have you seen the recent video that we posted?
Yeah, I have seen when you placed the threads to lift the nose and to give it a more of a straight look, and I saw you placing it along the midline, but I didn't see how did you do it with like to narrow the nose.
Oh, you've missed a big portion of my.
Yeah, I guess so.
That's a really nice. If you like, I can share my screen and maybe go on.
Sure.
To.
Of course.
Let's see.
I guess we are having something exclusive now.
Okay, so yeah, this is very, very exclusive. Let me try to give this to you. And this has not been posted yet on my Instagram. It's been posted on Empire Medical Instagram, but not on my Instagram.
Dr. TJ, I guess this is like a new technique and it's a little bit off label, right?
It's very
Because
it's
I
very
didn't hear about it, by the way, and I didn't read anything about it.
it's very 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 yeah, it's very
yeah.
awesome.
Thank you for sharing it.
Let me see if I can get it to play. I have to log into my Instagram. 1 second.
Okay, take your time.
Okay, I'm gonna go on share screen.
Okay. I guess all what you have to do is like to share your. Yeah. Okay.
Tell me if you can see my screen. Can you see my screen?
Okay.
Hello?
Let me check. Okay, I'm here with you once more time. Okay, let me check this. No, I can't see your screen. I just can see you.
Okay. Choose application window, StreamYard, share. Okay, let me see. Can you see my screen now?
No, I can't see it yet.
Okay.
Do I have to do something from my side to make it be able to, so I can view it?
Let's see if I can save this on Dropbox. Save in Dropbox. It may take a while. Change different filler. Boom.
Can you send me the link of the video after we finish the webinar, so can I can post it at the comment section below the webinar live, so so our audience can see it and see the technique.
I haven't posted it from my Instagram just yet.
Okay.
But you cannot see my screen, huh? Let's see. Application Chrome tab. Chrome tab. Is this Chrome? We are on Chrome. Chrome tab.
I guess because we are from the phone device. Yeah.
How about now? Do you see it now?
Hold on. No, I did. Nothing have appeared yet.
How about now?
No, I can see it. Do I have to do something from my side to make your screen appear, or it just it works this way?
No. Edit stop screen.
Hold on, doctor. I guess I can see. Okay. I guess you can share it right now.
Okay, so share screen, share screen, share screen, Chrome tab, Empire Medical, share. Okay, can you see this?
Okay, I did something from my side, so we can have like 3 screens. No, I still can't see anything.
Are we able?
Fine if,
Can you log into Empire Medical Training from your side to share them on Instagram, Empire Medical Training?
Okay, let me hold on for a second. The problem is that I'm from my phone device, so I guess it's not going to be able to share my screen, and I don't know how to use it from here. To show it on screen. Okay. There's anything that appear right now?
No, I don't see anything on the screen.
Okay. So I guess we can continue the discussion, and I can post the video later on, so people can visualize what we're going to speak about right now.
Sure. Let me try one more.
Okay. I have an idea. I can log on from my laptop, and I can like turn on my camera from the backside so I can show the screen of my laptop.
Oh, possibly.
Okay, let me hold on for a second. Okay. So do you want me to open Empire Medical Training or your Instagram page?
I'm playing a video. Can you see the video?
I can hear it, but I can't see it.
Oh, you cannot see it.
Yes. I like the soundtrack, by the way.
Offering capture screen. Okay. All right. So let's do this. Go use your laptop.
Okay, I opened it.
And go to Empire Medical and go to their. They just posted it today. I was hoping that they would wait, but they went ahead and posted it, which is fine.
Okay.
Do you have it on your laptop?
Yes, Empire Medical Training, right?
Yes.
Okay, I'm going to open their site right now. Okay, Empire Medical Training. I opened their website.
Oh, their Instagram. I'm sorry, Instagram.
Instagram. Okay. Okay, I opened the Instagram through the laptop. Not now. Empire Medical. Okay, I opened Empire Medical Training.
And this is their Instagram, correct?
Okay, let me change my camera. This
Okay.
one?
Give it a sec. Yes, but the post is dated today. Let me see. I cannot see.
This one?
Yes, 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 yes.
Okay, by the way, I won't be able to see right now, so I'm going to like do it all over again. You're gonna explain it, okay?
Okay.
But this is awesome. Is the video clear, Dr. TJ, from my screen?
It's horizontal. It's flipped the other way.
Okay, let me.
90
is it
degrees.
better this way?
Yes, and a little bit. Yes.
Okay, let me see with you if I can. Let me go down. Okay. I guess this is better, right?
It's very hard to see.
Okay, so let me try something else. What about this?
I don't know if it's better for me to show on my phone. Can you see on my?
Yeah, I guess it's better from mine. Yeah, it's. So typically you entered from the along the ala of the nose from the sides, and you entered like deep. You didn't reach the pterygoid fossa, by the way, right?
No, it's close.
Okay, then you entered with like a clockwise direction. I guess, yeah, it's like going from this side to this side. Yeah, I can see it. So could you, Dr. TJ, could you tell us the technique Yeah, this is
So,
pretty amazing, by the way.
so basically,
And by the way, it actually worked.
I'm entering here, okay, and I'm
Okay.
going through. Can you see? I'm entering here, and I'm going through under the nose to the other side here, coming out with the 18 gauge needle first. So I put a needle through here and the opposite side, but I don't go straight through because you're going to hit the nasal spine. The nasal spine goes up like that. So if you go straight through here and here, you're gonna touch the spine with the needle. It will not traverse. So you have to go just a little bit under, right? A little bit under, and just go underneath the columella. So you're missing the nasal spine. So the basic idea is this: you're putting a needle through here, and the needle now acts as a tunnel for you to put the thread. So you load the thread in the needle. The thread is bidirectional barbs, so the barbs are facing against each other. They're gonna squeeze and lift or push whatever tissue you need. So you put the thread in, then you take the needle out. Now the threads are sticking out like cat whiskers. It's kind of cute. It looks like little cat whiskers. And I trim them both sides and just leave a little portion sticking out. Then I take the nostril and I take the thread, pull the thread, and I stretch the nostril, and then effectively it stays, the nostril stays put like this. It stays like that. And then there's still that little bit of string left. I put it on the cannula and I tuck the extra thread underneath the philtrum. So we're tucking it in the subcutaneous plane just to hide the thread. There's no real function of that purpose. It's just to hide that extra thread that's sticking out. You don't want to leave it sticking out. You want to hide it. And that effectively closes or slims the nostril opening. And that one last technique that you saw in the videos, I placed the smooth threads down the alar, right? So some people may have like my nose, I have a curved alar, but some people may want it a little bit more flat and straight. So what I did was I put the thread down the alar and the smooth PDO, by the way, and the threads now give structural support. Remember, this is fibrous tissue. It's just fat and fibrous tissue right here. There's really nothing, there's no cartilage or bone or anything. It's just soft tissue. But the PDO thread, and it's just the simple smooth threads that I use to give structural support to straighten the alar. So that right there is very off-label. I think I've only seen a few people do that in like Russia. And then I also got the other idea for the smooth threads down the alar from the Koreans. So I kind of combined the Russians and what the Koreans did and kind of came up with my own method. It works.
Are you always this much fabulous? I mean, this is like truly amazing. It's my first time to hear this technique. How did you come up with this idea? You mean like modifying two techniques to give this wonderful result?
Yes, exactly. Just modifying two different things and coming up and putting it together. And because different countries have different looks. They don't have the same aesthetic values or virtues. And so, for example, like the cat eye, it's not very popular in Korea. In fact, it's not popular in Asia at all. So they don't really like it. They don't like that look because Asians typically have a slanted eye anyway. So we don't really want to look more slanted. We want to look more open. But the Russians, they really like that. The Russians and Europeans, and now all over the United States, like that's a very popular trend is to do the cat eye. So so I just take whatever I see and kind of mold it to become my own. There's no right way or wrong way. Just you find a way that works for you. But so I made sure that I dedicated some time every week. I'm very busy. My clinic is always very busy, but I try to dedicate like 1 or 2 days a week where I experiment. I play around with different things. Yeah.
And this what makes you the one and only Dr. TSAY. Uh, okay, so we are gonna call this technique the cat whisper technique. It's like something new
Cat
that you did.
whisker, that's cute because it looks like a little whisker that's coming out. You saw
Yeah.
the video.
Yeah, it's amazing. I'm going to post it, by the way, if you don't mind, on my own page, so
No, that's
people
fine.
can see this fabulous technique.
I want to
So
share with you the photo of the patient the same day after she left my office. She posted.
I can't even detect that you did anything. It's like very smoothly and very natural.
But do you see
Amazing.
her
Perfect.
nose?
Yeah. Perfect. And
And then she
actually,
also
you enhanced her profile from this area, by the way.
and
Yeah.
also her eye. I also did the cat eye the same day, so
Mhm.
she got both.
Okay, she looks perfect. She is now a very famous girl through Egypt and Middle East. We show their picture.
Yeah.
So, doctor, tell me. So we were speaking about the fillers and threads. Some people inject Botox at this area too. They think that it's going to narrow the nose during smiling. Do you think this things works, or it's just like we can do it to aid, but it's not going to make the patient feel of this much difference?
You mean the tip?
Yeah, I have seen people like doing Botox here and here and along the nasalis muscle on both sides. They think when they do this, when patients tend to smile, this area is not going to widen.
I think that works. I really do believe that works. Yeah, because I personally I've seen this done. I don't do it a lot, but even when I smile, there's a crease right here
Mm-hmm.
that forms right there. So if you hit that with like 2 to 3 units per side, you can block that pulling, and therefore their nose doesn't stretch laterally as much. Yeah, that's definitely I do believe that works.
Amazing. So since we were speaking about the Empire Medical Training Academy, from someone who was just learning aesthetics to someone who is like have one of the leaders in facial aesthetics as yourself, uh, how is this possible? A lot of people look to you as a role model and someone who can learn from you through your whole long journey. Um, Tell us more about what you do at the Empire Medical Training Academy. How much is it important? I know also that you give a lot of webinars and courses at the Aesthetic Immersion. How much do you think that those courses and workshops and education is very important, especially nowadays when you see a lot of disasters and catastrophic things that occur?
Yeah, well, going back to the Empire, I'm a KOL and speaker. I do speak at their special events, and I do some live demos, and I've done some webinars for them. So, I don't know. I see myself as a student still. I'm still learning. I'm always learning. That's the key. You're always going to be learning, no matter if you are good, you've become successful, you've got a busy practice, you always can learn. In fact, even during my training, I trained the mint threads in my office once a month with doctors from all over the place, all over the country. And every single time that I do a training session, I learn something from one of my students. It's very humbling that I'm there to show them what I've learned, but then they end up teaching me something that I never knew. So I enjoy it. I enjoy giving back. A lot of people have taught me, so therefore I'm grateful to give back. And also, I think now the Empire has a cadaver course. I think that's very important for a lot of injectors who have never done an anatomy course or cadaver course to really dive in deep and look underneath the skin, lift up the layers of the tissue, skin, subcutaneous, muscle, and see all the three-dimensional network of structures that's going on. It makes you a much better injector, and to visualize everything a lot more three-dimensionally in your mind, I think makes you a better injector, a better artist, and a safer practitioner too.
Mm-hmm. Do you have any upcoming events or webinars that you're going to do?
This is probably going to be one of my Well, it depends on the COVID situation. You know, United States is getting hot again, and a lot of people don't want Americans in their countries now. They're going to block us from entering the countries. So I don't anticipate traveling too much for the rest of the year. So yeah, you're right. I may be doing more webinars, but I am doing live trainings at my office for Mint Threads. And I believe they will be launching soon a thread class just for nose, a hands-on, where you don't just hear me talk about it, but you actually do it with your hands. You get hands-on experience. And in my opinion, threads for the face is a learning curve. It takes a while to get good at threads for the face. But threads for the nose and the cat eye, if you've never done threads before, I think those two procedures you can learn very quickly. You can get good at it very quickly, and you can get up and running with your in your office in a very short time and start to do this procedure and be successful at it. Whereas the face, it does take quite a bit of practice.
Mm-hmm. I see.
Sorry, Professor, I cannot hear you anymore. I don't know if you can hear me.
I'm sorry, the connections are not that much good.
Okay.
So I was just going to ask you if anything goes wrong while you're doing your filler, or I guess with threads it's a little bit safe than fillers. But if things goes wrong, how can you spot it during the injection, and how can you reverse it or like manage this complication? Because I guess in this area is very high risk for vascular occlusion, and at the same time, the worst case scenario, patient may get blind out of it.
Yes. Prayer, keep your hands crossed, and be very safe. Don't be overzealous. Keep small aliquots. Don't you know, when I was first starting, I remember using a lot of radius, being very aggressive, putting a lot of product, and that was not right. That's not right. That's not safe at all. Looking at how I first started, I'm lucky I did not cause any major problems or make someone go blind. I'm very, very fortunate. So after a year, I stopped doing radius in the nose and just started going more towards HA fillers. But looking at how I was doing things in the very beginning, I was very careless, and now I'm a lot more careful. So having a high, I've trained my staff to check for perfusion. I've trained all of my staff how to check for skin perfusion. So while I am doing nose fillers, during and after the nose fillers, my staff knows to give me that Q-tip and check for the skin perfusion. They always know to do that. All my front office that's answering the phone, they all know about necrosis, occlusion, blindness. They know how to quickly let one of us know if there's a problem. And then lastly, regarding the threads, because you're right, necrosis, vascular occlusion cannot happen with PDO threads. You cannot cannulate the artery with the PDO thread and cause a vascular occlusion. But what you could do is, if you happen to put the thread and you're too superficial, don't leave it there. Do not leave it there, especially with the, you know, the nose threads. Some of the nose threads come in barbed, and so you don't want to be too superficial with a barbed thread. If you think you are, just take the thread out right there. Don't leave it in there. don't leave the thread there. Take it out immediately and maybe do a follow-up visit so that to make sure that the patient does not have any problems.
I see. Dr. TJ, what type of advice you give to all young practitioners who are watching us right now, and they all look to you as a role model? What should they do to be a safe injectors?
I don't want to scare people because I don't want people to get too scared where then it paralyzes them from the creativity. Because part of my, I guess
Vision?
my design is very creative. I like to be creative and think outside the box and not go with whatever everybody else is doing. I see what everybody else is doing, but then I have a broader vision and see, whoa, what else can be done? And so be inspired and always learn, always be learning. And even when you think you're really, really good, you're not really. I mean, you can get better. You can always be a better practitioner, better injector. But don't be hard on yourself. You know, pat yourself on the back, give yourself a reward, and keep at it. Keep learning and be humble.
Dr. TJ, you have reached the end of our webinar. It was a great privilege and honor to have you as a guest in my Facebook page. Thank you so much for your precious time. And I hope when all this is over, you may pay us a visit in Egypt as a speaker in a conference or a course. And I'm going to be the first attendee, by the way.
Yeah,
I'm sure that we are all will be able to learn from you on the personal level. And I'm not saying this for any advertisement or blah, blah, blah. I'm saying it truly. You are one of the people that I learned from when I first started doing facial aesthetics. From your techniques at the Empire Medical Training, I was going on through YouTube, seeing your videos. So I truly respect your long journey and your experience. And it was a great privilege and honor. And I was so delighted by the amount of information that you gave us today, including the exclusive video of the cat whisker technique. Okay.
Yes.
Thank you so much, Dr. TSAY. It was a great pleasure. Have a nice day. Sure. What were you saying?
One day we will meet in person.
It will be a great privilege for me, sir. Thank you so much. Have a nice day.
All right.
Good night, everyone. Bye-bye.
Good night. Bye-bye.